I will not go through Cindy Blackstock's entire bio, but just to say we're really delighted to welcome her here. She's a member of the Gitxsan First Nation. She's a professor of social work at McGill and the founder and executive director of the First Nations Children and Family Caring Society. She is certainly within Canada, but internationally recognized as, a tireless and incredibly effective advocate for the rights and well-being of Indigenous children. There was an example in her bio, which is one of many, but really a landmark, a successful human rights decision around the pretty deplorable implementation of Jordan's principles for First Nations children in this country. Really, delighted to welcome her. One small thing, unless you if you don't follow her on Twitter, that I found particularly amazing is apparently a lot of the fuel for this incredible work are cheesies, which she tweets about, and that sustains her. So we're just really, really delighted that you're here to join us and start us off in a really great way. Thank you.
So it's a great honor to be on these territories, and I want to recognize the First Nations, Métis, and Inuit communities, and all of the people of diverse societies and diverse ways of being who have joined us here. We have to wonder why First Nations children are 10 times more likely to die in a fire than other children. We have to ask ourselves why First Nations children are 17 times more likely to end up in child welfare care than other children. We have to ask ourselves why so many First Nations children come into places like this at disadvantaged rates, often from preventable illnesses. And we have to ask ourselves why in a country where there is one of the biggest, if not the most, freshwater supply in the world, why some children grow up to dream about a glass of water. It isn't because we don't have the solutions. And I know that's not a popular point of view in a research hospital. But I want to take a moment to remind us about how we have been trained to assume that the problem exists because there is no solution. And how we often have ingrained stereotypes about how people who came before us reacted to the injustices of the past. We do that so that we can free ourselves of the duty and the obligation we owe to children to stand in the winds of systemic discrimination and take on governments and corporations when they need to be taken on. It's not enough to just adopt the TRC's calls to action and have a few training sessions. Sometimes you got to lawyer up and do the work against the governments, right? This is a headline from 1907. It is from Dr. Bryce, the Chief Medical Health Inspector of the Indian Department, former Chief Medical Health Officer here in Ontario. At the time when his report was in the headlines, he was president of the American Public Health Association. He had gone out and inspected the health of the kids in the schools and found out that they were dying at a rate of about 50% over 3 years. The reason was tuberculosis, made far worse because the people in Ottawa, where I live, were getting 3 times the level of healthcare funding than all, quote, Indians across the country. That, along with terrible health practices of putting sick kids in with healthy kids, about poor ventilation, right? I mean, when I saw the stuff on COVID-19, I thought, well, we knew this 100 years ago. Surely they figured out more about pandemics since then. But they knew a lot of that stuff back then. Those things could have prevented it. He was a man of science, and he came back to the government, and he was a man of the government. He believed that presented with this evidence and the meager costs of these reforms, which would have been about $10,000 to $15,000 in a $100 million budget, that the government of Canada would act. The government of Canada did not act. It didn't fail to act. And this is a word that we need to check. It chose not to act. That's a different thing. It chose not to act. And then we tell ourselves that people of the period back then didn't know any better. That's why these problems existed. Well, Dr. Bryce was not alone. These are the headlines of the newspaper, so the editors clearly knew that this was not only unacceptable, it was an absolute travesty. Something else that's really important. If we look on the right-hand side and you see Saturday Night, and some of you of my vintage remember Saturday Night Magazine, which was published until just recently, actually, here in Ontario. Well, this is the headline from November 23, 1907. And there's a headline there that I think really needs to stick with all of us. It says, his report is printed. Many people will scan the title on the cover. Some will open it. A few will read it. And so the thing will drift along for another year. And so with the next year and the year after. Such will be the course of events. The protests of medical officers buried in blue books and the complaints of missionaries lost in pigeonholes, unless public opinion takes up the question and forces it to the front. Then Parliament will show a quick interest. Pigeonholes will give forth their dusty contents. Medical health officers will have a wealth of suggestions, and the scandalous procession of the Indian children to school and onto the cemetery may possibly be stopped. These were national headlines, and they are not exceptional. This is the Ottawa Citizen. This is also in 1907. You can see there, schools a white plague. And one of the things that we think about is, well, who was reading these headlines? Well, one of the people was Samuel Hume Blake, a lawyer, later a judge. And he asked an interesting question. And when we reflect back on the recent Pope's so-called apology, and I put that in brackets, the questions were asked, well, can we hold some of these wrongdoers accountable? Well, the question that wasn't asked, that ought to have been asked, is the one that Blake posed to us in 1908. And that is, did Canada's choice to not obviate the preventable causes of death bring the government of Canada into unpleasant nearness with manslaughter? Is the government culpable for manslaughter? Are the churches culpable for manslaughter? That's the question that needs to be asked. And then the question two is, where were all of Dr. Bryce's contemporaries in this movement, right? This is the guy, remember, he's president of the American Public Health Association. He's no slouch. His health code here in Ontario was taken up by many of the United States and also was used as a format, a template for many Canadian provinces and territories that would come later. And yet there wasn't that groundswell of professional requirement pushing the government to do more. And this is the guy, one of the bureaucrats who said no, Duncan Campbell Scott. He was known as a Confederate poet. When I met him in high school, there was only talk about his poetic prose and not of his day job, which was 52 years in charge of the residential school file. I need to say that Dr. Bryce, of course, when his findings were hitting the newspaper, it was Prime Minister Laurier who was in power then. And Bryce wrote directly to Laurier and got the same response of go back to Scott, right? Now, the one thing that's interesting is we talk about people of this time and we say, look, you can't judge people like Duncan Campbell Scott by today's standards. But what we do with history is we don't whitewash history. We whitewash history. We erase the people who were on the other side of the injustice raising the alarm. And in that way, we're able to say of John A. Macdonald that, oh, he was a good guy. Well, there was the thing about the discrimination towards Chinese Canadians, and there was the unfortunate circumstances with Indigenous people, but look overall is the invitation we receive. Now, in Duncan Campbell Scott's case, when this was coming to the fore, thanks to the truth of the survivors, and I call them truths, I don't call them stories. A story invites us to think they're fictional. They are truths they were telling us. right? Had we listened to them, the unmarked graves would have not been a surprise and shock to Canadians, right? It was because we chose not to believe it. It wasn't we failed not to believe it, we chose not to believe it, right? We need to appraise people's histories properly, but we need to weigh out their legacies. Canada would be okay without Duncan Campbell Scott's poetry. Trust me, I've read it. But the legacy that he and Prime Minister Laurier and others left for residential schools is one that we're still reckoning with. Let's go forward to 1958. We're going to skip some decades. This is from a former departmental employee. I say former because he was fired. And he was fired because he was viewed as being too close to the Indians. He's giving a talk very much like I am on human rights in Tobique First Nation in New Brunswick. And here he's laying out the various ways the government steals Indian human rights in his view. And I've just chosen 4 here. It's about 3 pages and about 20 long, and I can send you the original document if you're interested. But one of the ones that, a number of these are so familiar to me. The first is the Be Patient speech. Be patient, First Nations. We've gotten rid of a bunch of water advisories, long-term water advisories. How do you get rid of a long-term water advisory? You probably never asked yourself. Well, all you need to do is truck in water. And why is it that we have to deal with long-term water advisories when, when the windstorm came through Ottawa and people's water was off for a day or two, it wasn't, well, you should be very happy and grateful for the long-term water advisory. We've trucked in water to you. The standard was to bring it up to par. The Be Patient speech is always given by those who already have their rights recognized, right? And it's an invitation for us to normalize discrimination towards children and towards others. It is a long arm of injustice. And we should not and ought not to accept it. And we need to be clear that as I stand here, we have an apartheid public service system in Canada. The federal government funds the services for First Nations, does so at far lesser levels across the board. And then it makes the public feel like the problem isn't that we're getting underfunded. The problem isn't that we are still trying to address the trauma of residential schools and all other kinds of forms of colonialism. The problem is that we're not thankful for all the extra support we get. When they turn on a tap in a First Nations community, they call that reconciliation. When they turn on a tap in Toronto, they don't call it that, right? But these are the mind games that allow us to get into this place of inertia. So I entered into this whole field as someone who was scared stiff of public speaking and who was convinced, like Bryce was, that there was nothing. Like the government must have been underfunding First Nations children because it didn't know any better. So I got together with people who were smarter than I am in the First Nations community. We worked with the government. We documented it. And then we provided a solution for them to fix it in 2000. And they sent us a nice letter. They said they were reviewing it. And they even did some of the easy stuff like training. But they didn't remedy the inequality. Then they sat on it so long that the report becomes dated and they want to do another report, right? What I ought to have done is look backwards first, and that's one of my pieces of advice for you. I'd like to see research institutes actually have an archivist on staff to go back and document all of the recommendations that might be relevant to the issue that you're trying to solve. Because that alone would let you know whether the problem is that the solution does not exist, or the problem is, as we saw in that headline, is that we don't have the guts to really stand in the winds of discrimination and implement the solution. Those are 2 different things. So you saw that, and then we decided, along with the Assembly of First Nations, to file a human rights complaint. And I remember thinking, even naively back then, oh, now they're going to know we're serious and they'll do something. And they did. They cut all of our funding within 30 days, right? And this is what they did to Dr. Bryce too. They retaliated against him. And one of his family, and the retaliation included erasing him from Canadian history. But they did something else, and that was that he died feeling he was a failure. His family says his greatest lament was that the work did not get done. He was a doctor. He took that same oath that many of you have taken as healthcare providers and healthcare researchers. And he knew these kids' lives could be saved, and he wasn't able to do it. And I don't want that to be our story, right? We actually predicted exactly what would happen, right? This is in 2005. I'm not very good at predicting things, otherwise I'd win the lottery a lot more. But this is from our report with the government. You can see here, the cost of doing nothing could result in Canada being found vicariously liable for discriminatory funding and child welfare, knowingly resulting in harm and disadvantage for another generation of First Nations children. The political fallout will be substantial, especially on the heels of residential schools, right? And when people hear the $40 billion deal, keep in mind, this problem in 2000 could have been solved with hundreds of millions of dollars. There would have been no $20 billion in compensation because no children would have been victimized, right? And these are the things that we do when we kick things down the stream. We can sit around these tables and talk about the disadvantage and study it. But all the while you're doing that on the ground, children are suffering. They're losing their childhoods. And for those of us who work with children, those of us who believe in that UN Convention on the Rights of the Child, that is not good enough. We must ask more of ourselves. Now, you might wonder if the government knew that discrimination was happening in child welfare. These are some of the documents we filed in the tribunal. The one on the right, the fact sheet, was on their website the day we filed the case. And I am not a great technical person, but I quickly figured out how to do a screenshot. Because this particular fact sheet links the underfunding of the First Nations child welfare with, quote, growing numbers of kids in care. Then we have this bottom one, Q3, is a deputy minister's speaking notes for Parliament. And you can see there, they're not shuffling the deck. They're saying it's a dire situation, right? And then up at the top, you can see that they're linking it in another briefing note to the underfunding, that these kids are being separated from their families in the wake of residential schools at greater numbers because of them. And what were they doing all the time? They were saying that they were defending each of you and your tax dollars. We can't trust the Indians with the money. So what we're going to do is we're going to protect the taxpayer against this kind of stuff. Jordan's principle is the expense side of that balance sheet. Of course, it comes from the story of Jordan River Anderson, and I would just mark in your diaries, along with honoring the National Children's Day on December 12th, we'll mark the 15th anniversary of Jordan's principle going through the House of Commons. Now, this is a principle to ensure that First Nations children on and off reserve can access the healthcare services they need when they need them. We have, thanks to the litigation, been able to break down another really racist strategy by Canada, which is the Indian Act. I am a super elite member with Air Canada, and what Canada wants you to think is my status card is the equivalent. Imagine if we rolled out a strategy and I decided as Prime Minister if your child was a status child or not. That is literally happening right now. We have the only race-based act in the Western industrialized world. This act was a template for apartheid in South Africa. We were able, through the litigation and through the Canadian Human Rights Tribunal, to get recognition of children by their nations to be the standard off reserve. So the child does not have to have status. All they have to do is be recognized by their nation, and they are eligible for services under Jordan's principle. This is very important for all of you to know. There's also the Inuit children's piece. Now, what we've also found is people have embedded this idea of saying no for Canada already. They'll never approve that. Let's not ask for it. And what I say is, if you as professionals think that a child needs something, ask it. These guys owe these kids. They have short-run these kids for 153 years. It's time that they actually treat this generation properly in keeping with the principle of substantive equality. We've had rooms for children with autism built, quiet rooms. We've had cultural services provided, education supports, respite, medical transportation, assessments. All of this kind of stuff is possible. So just use your own professional judgment and don't hold back. The kids really need you to give them a little bit of a boost, right? This is how you can get a hold of the 24-hour line. Be clear, if there's an urgent case, and that includes children in palliative care, tell them it's urgent. They are not able to overrule you on that. And they should be deciding that case within 12 hours and making sure it's available. It's available in French and English. This is something that should be on every hospital wall. What else are we doing? Well, we have, for the first time in history, actually got prevention funding out to keep families together starting of April of this year. It's the first time since the whole founding of the country that we've had that injection. And we have fabulous people like Amber who is making that happen on the ground. And I should say, as a shout out to First Nations agencies, that even under the underfunded regime, they were able to keep more families safer together than the off reserve was. And that tells you something about the level of dedication and skill in many of these agencies. Right now, what we're trying to do is drive the money and drive child welfare and drive First Nations funding by the outcomes and needs of the kids. That is the challenge we're having. We want to actually, we're realistic now. It really is the almighty dollar that is the driver in a lot of this. So if we can drive the money towards the children and make sure that it takes into account the diverse and distinct different types of situations First Nations find themselves in, then we may have a better sense of a success, instead of just a funding formula that's based on population need, etc. And what we're trying to do is get at the drivers that Dr. Fallon has documented for over 20 years. The poverty, the poor housing, the substance misuse, the domestic violence, all of that is the cocktail, the fire of child welfare. And one of the things I think we do badly in child welfare is we try to fix the child welfare system. I actually don't think that's the problem. I think we need to go after that poverty. We need to go after the housing. We need to go after the trauma that leads to those addictions. That's the same devastating fire that fuels the overrepresentation of young people in juvenile justice, that pushes children into your hospital and into the other areas of disadvantage. It's one of those ways we seduce ourselves into thinking we're doing something, right? And often it involves some kind of new tool, right? I remember when the structured decision-making tools were something new. We get these ideas from the Americans often, right? And they charge us a huge royalty. That's the kind of thing. Or we do things, we will take a symptom or a particular micro problem like birth alerts, and we act on it as if it's a problem without any evidence of whether that's actually the problem or not, right? So what did the CHRT change? Well, number one, we have had over 2 million services provided by Jordan's Principle since 2017. I would actually say 2017 in April. They were ordered to stop their discriminatory conduct in 2016. And you might remember the parade of ministers coming out welcoming the decision. Well, we're now up to 23 non-compliance and procedural orders against the government since that time. So that same pattern, back with the reports, thank you for the nice report. We're here for you. We love kids. That's still going on. But then you have to fight them in the background. And I think this is a lesson for everybody, right? Is change don't get sucked into an official procedure like an inquiry or a report or a commission, because they'll give you that. But that doesn't change lives for kids. Our job is to walk into a community until a child and a family can say, my life is better today than it was yesterday. We have not done our job. And that's problematic, I think, in academic circles, where we line our CVs with all these research projects, etc. One of the things I'd love to see is from CIHR and SHRC and other bodies is implementation research. And we have to stop marginalizing people who are actually working on the implementation of evidence-informed solutions by calling them activists. Right? These are the people making a difference out there. We have a solution. Let's cost out all the inequalities First Nations kids face. Why is it that a First Nations child still has to grow up with the dream of getting a clean glass of water when other kids can grow up and dream of being engineers or artists? We say that's not good enough. This was passed by the Chiefs Assembly in 2017. Canada's never adopted it. They're waiting for you to do exactly what that headline says. Cost it out, and then you do something like the Marshall Plan after the Second World War and roll it out. Or as my mother would later say, and my mom's 85 now, when the pandemic hit, she said, where the heck are they getting all this money from? Right? She said, you've been working with these First Nations kids for years, and all you want is to kind of make sure that they have like equitable services, and all of a sudden, the Canadian Mint is printing these $100 bills like there's nothing out there like tomorrow, right? It's true, right? Why do we get sucked into this, right? So they can do this. They really can. And if they can't, we need to be really honest with ourselves. We are allowing the government to use racial discrimination as a fiscal restraint measure against children, right? So here are some of the inequalities that still arise, right? And there's such privilege even in the COVID-19 pandemic, we found. Although First Nations, the Métis and Inuit children were so grateful to get access to the vaccines and their parents, for many of these communities, COVID-19 was not the worst case scenario. They were struggling to get clean water, right? Like COVID was down the list. If you were, COVID-19 was your worst worry, then you were in a situation of privilege, right? And I told my students that at social work, they were whining about Zoom, you know? And I said, look, I said, do you know 35% of First Nations homes have broadband access? You are so lucky to have that, right? You can imagine what it's like having me as a prof, right? I was really honored to work with Ryan Giroux and Roger Jetty and Sue Bennett. We did this paper on COVID-19 and First Nations, Métis, and Inuit children. We wanted to kind of just put out there some of the things to think about for medical professionals. It's really basic kind of stuff, but one of the things I'm going to ask you not to do is stereotype. Even among the First Nations, there's such rich diversity. I come from the West Coast. We do not have the medicine wheel. We do not have smudging. We do not have a lot of these other kinds of things. We have a lot of totem poles, and we have feast houses, and within the various cultures, even here in Ontario, such richness and diversity. It doesn't mean that that should scare you, by the way. All you need to do is follow the good words of my friend and mentor, Joan Glode. And she said, I want to be respectful. Can you please guide me? That's what you need to do. And you need to self-educate as much as you can, too. Watch some of the amazing films by Ellen Niso-Bomsawin at the National Film Board. She has about 52 of them, so that'll keep you busy for a while. And also Joyce's principle out of Quebec. You all saw the situation with Joyce Echaquan. The filming about the racism within the healthcare system, that is a reality. Now, I want to say, and I want to thank all the healthcare providers. My sister's a nurse. I know how hard the job can be. But we need to do better. We need to make sure that we're holding accountable those persons who allow systemic racism to exist, and those persons who to do that systemic racism. Now, as far as I'm aware, Joyce's principle has not been formally adopted. And I'm not sure it's even been formally adopted here in Sick Kids. But here's an opportunity for all of us to adopt that principle. The TRC's calls to action, we look at those headlines. The number one ask of the survivors was, don't let our grandkids go through this. That's why the top calls to action are all about children. The number one call to action is equity and child welfare. Stop taking our kids away when we could keep them safe at home. And that's not to say that there are challenges in the families. We know there are. But we at least deserve an opportunity to be able to fix some of those challenges that weren't ours at the creation. Jordan's Principles and number 3 call to action. We have a child version. So if you want to download that for use in your PEDS departments, you can go ahead and do that, right? And we have all kinds of ways of educating children and others. This is an animation on Jordan's Principle and about the tribunal case. Kids actually see the discrimination very clearly, much more clearly than adults do, because they haven't been bathed in this indoctrination that we've become comfortable with, right? So watch this animation. It's available from us. We self-produce it with the amazing Spotted Fawn Productions and Indigenous Animation Studio. This is one of 4 we have. We'll have a 5th one soon. And they all tell the stories, the true stories of how children of all diversities stood with First Nations children to end the injustices. So you can check that out. There's documentaries by Elenisa Bomsawin. The We Can't Make the Same Mistake Twice takes you right into the tribunal courtroom. You don't need to listen to me. You can watch the government officials testify on their own. Jordan River Anderson, the messenger. Please do not use the acronym JP. Always say his name. It's a way of honoring his spirit. And please spread that word to your colleagues. And the reason that those kinds of acronyms are problematic is because they dehumanize. They actually make discrimination more easily done. But that's a picture of the little boy that the government of Canada said no to and who died in a hospital. So what can you do? Learn about these entrenched inequalities. Stop yourself when you make these assumptions, when so easily you see the Be Patient speech and you let it go by on your screen. Watch yourself when you see the Murdered Missing Indigenous Women and Girls report and see nothing happening. Watch yourself on National Children's Day, when we see all kinds of things happening, but no one actually filing claim against the governments for failing to implement the solutions that are on the books. Access Jordan's Principle for your patients and for children in your healthcare. It really is one of the family's greatest honors. For far too long, Jordan's Principle was not implemented by Canada, and the one place of justice and support the family have is seeing other children benefit. Advocate for the full implementation of the Spirit Bear Plan. No more partial inequality or partial equality for First Nations kids, right? Demand more. Do what I do. I actually print out the TRC's calls to action, Spirit Bear Plan, during election time. When they come to my door, I hold it up, because they always have the same speech. Can I count on you for our vote? Right? And I kind of put my glasses on, because I only see these people every 4 years. And I say, that depends. What have you personally done to implement these things? Right? And that's the question I keep asking them when they're in office. Ensure that you account for the differences in patient access. A lot of folks presume that there's clean water everywhere, so why can't you wash your hands if a child has got an infectious disease? Why can't you, you're discharging to an overcrowded house and then you're expecting people to socially distance, like it's not going to happen. And adopt Joyce's Principle. I'd like to see Sick Kids be one of the major hospitals that adopts Joyce's Principle. If we're going to raise another generation of First Nations, Métis, and Inuit kids who don't have to recover from their childhood, it should start here. Because children are the keepers of the possible. Every generation of children that grow up can be the world and the society that not only tries to overcome difference, because overcoming difference I'm not a big fan of, because overcoming difference for us is meant assimilation. I want to raise a generation of kids who celebrates difference, who's comfortable with difference, who embraces difference, and a generation of children who know how to stand up for human rights, for themselves and for their neighbors. That's our opportunity, and for them, we need to model it. Because, and I know it's not popular to cite Russians right now, but there was a great Russian saying that children will rarely listen to their elders, but they never fail to imitate them. And that's why we turn the other page, even though in 1907 we were asked to speak out. Thank you all very much.